First of all, thank you so much to you for organizing all of this. You have no idea what this is doing for me professionally and personally. This is a topic that I'm like super psyched about. So a little bit about me. I am an occupational therapist. I have been practicing for almost 2 years now. I work at a level 1 trauma center for West Virginia University Medicine. So it's the largest hospital that we have in our hospital system across several different states in West Virginia, Maryland, places like that. So, and I'm also in school through Towson University to get my post-professional doctorate degree. So right now I'm doing my capstone project, and this whole interest for me in postpartum care and OT kind of started really when I first started working at my job. I was on orientation in August of 2021. So it was still, COVID was still pretty bad. Delta had just kind of started making its rounds, and we were having a large influx of pregnant patients that were coming in with COVID and needing emergent C-sections. So I was on my orientation through all of this in the cardiac ICU, seeing C-section moms who had delivered very early on ECMO and just still like crushing it, doing all the things. And I was like, holy moly, like this is, first of all, this is amazing. And then I was, still seeing them, seeing other patients. And I was like, wait, why are we not doing like newborn care things or things that they're going to have to do at home relating to caring for themselves or their newborn? But again, I'd only been working for a couple weeks at this point. So I was like, we'll figure it out as we go. And then, fortunately, COVID got better. Those patients, we don't have as many of those anymore. But very early on, about 2 years ago, is when this seed kind of got planted into my head. So I started going through school, going through the courses, and the topic of what do you want to do for your capstone kind of came up. And I was like, well, I really want to do something, with like COVID patients and these pregnant moms that are coming in. And, like there's so much trauma, and I feel like opportunity for us to really invest our services in them. But fortunately, there were not as many COVID pregnant patients anymore. So I was working on another project for school, something that I wasn't like super interested in, and just made like, if the idea popped back into my head, made a random Facebook post. For those of you on Facebook who have had C-sections, do you think you would have benefited from talking with an OT prior to leaving the hospital about how to care for yourself, how to care for your newborn, how to move, how to get out of bed? Just curious. Didn't really think anything of it. And a couple hours later, there were like so many people that commented and were like, yes. Like my Facebook friends kind of know like what OT is because of just me posting things. And then people started messaging me saying I had trouble with this. Like if it wasn't for my partner, like I would have struggled so much and I needed all this help. And I had so much pain and swelling, and I wish someone would have talked to me before I left the hospital. I felt like I was just given a baby and sent home. So I was like, okay, I guess there's an opportunity here for this. So my advisor for my project is actually on here, Dr. Kendra Heat-Welshank. So she's like in the ringer with me with this right now. So we've been working together all summer. I took the ERAD course kind of like late or early summer, finishing it up, and it's been fantastic. I have nothing but great things to say about it. Giving me such a foundation and like such a fire in my soul for what I want to do. So as of right now, I have met with one of the main physicians in labor and delivery at my hospital, explained to her what I want to do. And what I want to do, long story short, is at our hospital, we have different teams of populations we see: cardiac, neuro, ortho, trauma, oncology, pediatrics, so on and so forth. What I want to do is I want a birthing center team. I want a labor and delivery team. I want it to be a regular protocol so that any woman who gives birth in the hospital is seen by PT and OT postpartum day 1, regardless of how you gave birth. So I've met with one of the main physicians at our hospital, and she's super excited about it. She even said, I asked an outpatient pelvic floor PT about this when I first started here years ago, but they said because they were outpatient, it would basically be like pro bono for the inpatient side. And she said, so truthfully, I never thought about it. And I'm embarrassed to say I never considered OT to service this role as well. I was like, well, it's nothing to be embarrassed about, but that is our job. And if you don't know what we do or what we're here for, then, why would you? So talking with her, and I am doing a grand rounds presentation with our OB department in November.
Marley, congratulations. That's huge.
Thank you.